Cushing's disease is also a disease of the adrenal gland, specifically the adrenal cortex. Um, Cushing's is directly opposite from Addison's disease. So Cushing's disease is excessive cortisol. Remember, Addison was like no cortisol at all. The adrenal gland was underproducing. Cushing is excessive cortisol, so overproduction of cortisol. So why would a patient have Cushing's? Cushing's can be as a result of maybe like a tumor or excessive use of steroids. So overuse of steroid can end up in Cushing's. Okay, Cushing's disease. And with Cushing's disease, some of the clinical findings that we see with Cushing's disease will be moon face. So just think of somebody that is puffy, because it's directly opposite of Addison's. Addison's, we said there was a lot of weight loss. So with Cushing's, there's excess weight gain. So the patient's face is kind of puffy, which the book describes it as moon face, buffalo hump. So that if you feel like there's a hump in the back, so moon face, buffalo hump, central or truncal obesity, and the skin is thin and easily bruised. Okay, so damaged skin and easily bruised. So this is a patient that has excess steroids in their body. The overuse of steroids, excess cortisol. So the skin is thin and is easily bruised. Remember, for Addison's, the skin was bronze skin hyperpigmentation. Here we don't have hyperpigmentation, but we have a thin skin that is easily bruised, triad marks all over the patient. And again, as I said, truncal or central obesity. Patient feels like puffy, the moon face, buffalo hump, and so those will be some of the symptoms that you can see on the patient that can easily identify as excess use of steroid, or they're having Cushing syndrome. Then what about labs? What kind of labs? So the lab or the electrolytes that we're looking at here will be directly opposite to the electrolytes that we have for Addison's disease. So now, therefore, for Cushing's, we'll have hypokalemia, low potassium levels. Again, I said in the adrenal gland, the disruption of the adrenal cortex. When the potassium levels are going high, you see sodium levels are dropping. So now for Cushing's, potassium levels are low, then sodium levels are high. So hyperkalemia and hyponatremia, which is directly opposite of Addison's disease. Again, blood sugar. We're talking of steroids, right? Steroids causes elevated blood sugar. So if a patient has increased steroids, therefore there will be hyperglycemia, which is opposite from Addison. So hyperglycemia, they have high blood sugars. So high blood sugars, and so some of the things that we want to be cautious of as nurses is, again, the steroids, right? Because it's excess steroids. So now, because the patient already has excess steroid, we cannot give them steroids. We have to wean them off of that steroids. Steroids is one of those medications that you don't want to stop abruptly, because again, as I said in my last recording, if we stop steroid abruptly for patients that have adrenal disruptions, they may go into Addisonian crisis. Okay, but then since for Cushing's disease, they already have steroids, so therefore we'll try to wean them off of that steroids. And then if you're weaning a patient off of steroids, you have to monitor them very, very closely, because there are some signs and symptoms that the patient will show or manifest if we wean them abruptly. First, they'll become hypotensive. So if a patient is Cushing's disease and suddenly they just become hypotensive, could be that we're trying to wean them off of that steroids, but we're doing it too fast. So hypotensive, fatigue, okay, and then all of that will suggest that, maybe we're weaning them, we're tapering them too quickly or weaning them too fast. So again, Cushing's disease is directly opposite of Addison. So my advice to you is that just study one. Okay, study one very well, and then you know that the other one is the opposite. Both of them are disorders of or disruptions of the adrenal cortex. Uh, so just know one, and then the other will be opposite. Okay, for me specifically, I like Cushing. So you study Cushing so well, and then you just know that Addison disease will be opposite. So now, if you want to look at the electrolyte imbalances of Cushing's disease, because we already said that they have low potassium levels. So what kind of diet do you want to recommend for a patient that has low potassium level? For a patient that has high sodium levels, what kind of diet do you want to recommend for these patients? So what kind of signs and symptoms would you see on a patient that has a potassium level that is dropping? So therefore, with these patients, would you think that is important for them to be on a cardiac monitor? Cushing patients, probably yes, because look at that potassium levels. They have hypokalemia, so we want to know what the heart rhythm is. So let your patients be on cardiac monitors. And then we talked about skin. Their skin is easily bruised. So if you have a patient that his skin is easily bruised, you want to make sure that you're doing skin precautions to prevent skin breakdown or infection. Overuse of steroid, or any patient that has excess steroid in their body, it puts them at risk for infection. So therefore, your Cushing's disease patients have higher risk for infections because of that high steroid levels. So you're putting all of that into consideration as you're trying to answer trying to answer questions in relation to Cushing. Again, this was just a brief overview to enhance your knowledge on Cushing's. Again, the pathophysiology for Cushing's is that they are producing excessive cortisol production, okay, which can be as a result of maybe sometimes a tumor or excessive use of steroid. Again, some of the physical assessment findings is we'll see for our patients are moon face, because they are puffy, the face look puffy and shiny, buffalo hump, truncal or central obesity, skin is thin and easily bruised because of that high steroid levels. Skin is thin and easily bruised, so you want to do skin precautions and all of that. So yeah, this will be it. Again, just remember that these videos are meant to just enhance your learning, to help you answer those questions. Cushing disease and Addison disease, both in the adrenal cortex, and they are directly opposite to each other. So just know one, and then know that the next will be opposite. Thank you, and I'll catch you guys later.